Let us start with second part, and here we are going to start our main process, that is mechanism of labor. So at the onset of labor, the occiput is in LOT position, okay, that is the cardinal position number 1, okay, and the shoulders are in, this is head, okay, the shoulders are in AP diameter, okay. So anterior shoulder is at position number 3, anterior shoulder at position number 3, and posterior shoulder is at position number 7. So coming to 7 cardinal movements. So first movement is engagement, second movement is descent of head, that is the most important factor for descent is uterine contractions, and the third one is flexion. Flexion occurs simultaneously with descent, and the fourth one is internal rotation. So internal rotation is also in anterior direction, and it occurs at the level of ischial spines. So coming to according to Hart's rule, before going to Hart's rule, you need to see that there are 1 to 8 positions. Pubic symphysis in the anterior shoulder and sacral promontory where the posterior shoulder is present, and in the one position occiput is present. So according to Hart's rule, occiput touches the pelvic floor, that is the levator ani muscle, okay. After that there will be elastic recoil. After that occiput rotates anteriorly, then it lies directly behind pubic symphysis, and after that occiput rotates 2/8, reaches the direct occipito anterior position, and the shoulders rotate by 1/8 in the same direction, that is 1/8 torsion on the neck remains. So shoulder line left oblique diameter, that is position 4 and 8. So coming to crowning, crowning in the name itself, you can see the head of the baby stretches the perineum and it is permanently visible at perineum. Episiotomy is given during crowning if necessary, not for everyone. Coming to extension is the fifth one. Extension is the head of the baby deliver by the movement of extension with further descent. So first occiput, next vertex, next brow, next face presentation. Coming to external rotation, there is posterior direction, restitution, head rotates posteriorly by 1/8, head of baby untwist, shoulders rotate posteriorly by 1/8, manifest as external rotation of head by 1/8, total posterior rotation of head 2/8. So coming to occiput, it is in LOT position, face is towards the mother's right thigh, shoulder is in AP diameter, anterior shoulder delivered by posterior shoulder expulsion, entire body is then delivered by lateral flexion. So this all actually we need to understand. Next coming to management of labor. So steps to prevent perineal tear: apply warm perineal compresses, relax the levator ani, and do perineal massage, maintain the head in flexion with controlled delivery of head, give perineal support with one hand according to WHO. Universal episiotomy and routine fundal pressure should not be done. So coming to planned surgical incision on perineum is episiotomy, and we know we already differentiated between medial, lateral and median episiotomy. So indications for episiotomy, only then you need to do like shoulder dystocia after coming head of breech, instrumental delivery, macrosomia, episiotomy scissors, phase 2 pubis delivery. So structures which are cut, this is very important. Let me write this now because all those previous topics already discussed, okay. So structures cut in mediolateral episiotomy, this is important. So first structure is levator ani muscle. In levator ani, it's divided into pubococcygeus and iliococcygeus muscle, okay. These are the two muscles. After that the second cut structure is superficial and deep transverse perineae, and third comes bulbospongiosus, and fourth comes pudendal nerves and vessels. Fifth comes posterior vaginal wall. So all these are cut in episiotomy. Sixth comes subcutaneous tissue and skin. So these are all the structures which are cut, but remember one thing, the structures which are not cut, this is important, not cut are ischiocavernosus, ischio-coccygeus, external anal sphincter. So these things we need to keep in mind. So by this we completed mechanism of labor chapter. Next we are going to discuss induction of labor.